In today's morning rounds, a new warning about painkiller addiction and how it can start after a common surgery. About 5 million Americans choose to have their wisdom teeth removed every year. Most of these procedures happen in the summer, and most are adolescents and young adults, ages 17 to 21. Meg Oliver is here with what patients and parents need to know to avoid the dangers of addiction.
Tony, good morning. Listen closely to these numbers. The American Dental Association says after updating its guidelines advising against prescribing opioids, dentists wrote almost 500,000 fewer prescriptions in 2017 compared to 5 years earlier. But with 18.1 million filled, the numbers are still staggering, and some families are living with devastating consequences.
Everything that she could do to teach Julian new things. That was her favorite thing, was watching him learn.
Julian was her life.
Oh, yeah.
Ellen Early's daughter, Sage, was a young mother doting on her 16-month-old son, Julian.
That day at the dentist's office must haunt you.
Yeah, very much.
In 2017, the 22-year-old needed to have her wisdom teeth removed.
The dentist prescribed the opioids.
Right.
Did he give any warning?
No. No warning, no nothing. In fact, he said, I think they gave her a 5-day supply, and he said, if you need more, just let me know. Just give a call.
Sage quickly became dependent, getting several refills before she found something else.
How quickly did it go from opioids to heroin?
Almost immediately.
Just 15 months after having her wisdom teeth removed, Sage overdosed and died in an airport bathroom on her way to a 4th round of rehab.
It was shocking. And she was gone, but mostly gone from Julian. That was the shocking part.
I've heard many stories that are similar to this one.
Dr. Chad Brummett studies pain at the University of Michigan. He says despite research showing that a combination of acetaminophen and ibuprofen is superior to treat pain, dentists are still prescribing too many opioids.
For many, dental care, such as wisdom teeth extraction, is the first opioid exposure. Could be like 50,000 kids each year becoming new chronic opioid users after just something simple like a wisdom tooth extraction.
Dr. Brummett's research found that simply filling an opioid prescription after wisdom tooth surgery more than doubled the odds of continued use among patients who had never used those painkillers before. In light of the epidemic, the American Dental Association has released updated guidelines recommending use of alternative pain relievers and a maximum 7-day supply when opioids are necessary.
Nice to meet you.
Dr. Joel Finari started cutting back on writing opioid prescriptions more than 5 years ago.
They don't have to fill it. I asked them just to take it and have it available as a tool.
80% of Dr. Finari's patients never fill the opioid prescription. He believes taking the time to educate them reduces the likelihood they'll actually use it.
The key is keeping swelling down and keeping your mouth clean because that's the primary cause of the pain.
Ellen Early hopes more families learn about the alternatives to opioids after dental surgery. Almost a year after Sage's death, her grandson keeps asking when his mom is coming back.
And he remembers her, and he says, he'll take me into her room and say, well, let's just wait. Let's just wait for Mama
To come home. That must break your heart.
Oh, absolutely. Absolutely.
Julian is now 3 and will start preschool this fall. Dr. Brummett, the University of Michigan researcher, told me it's still common practice for oral surgeons to write that backup prescription, but he says it's misguided and potentially detrimental. His message to families across the country this morning, you do not need opioids for standard wisdom tooth surgery.
So maybe not write the prescription then. Is this a common thing in dentistry?
And
you get opioid prescriptions?
They write it as a backup because they get worried that they might have severe pain. It might happen overnight where you can't fill a prescription at that point or on a weekend. But Dr. Brummett is saying that that combination of acetaminophen and ibuprofen, that's a superior form of treatment for this type of surgery.
All right, Meg, thank you.